we create early disease detection solutions that allow providers to focus their scarce clinical resources on patients who most need attention. Because the evidence shows everywhere that when patients get attention early, they have better outcomes, they have lower overall costs of care, and that intervention also yields higher margin outpatient specialty care, which is good for the margin profiles that provider organizations need. So today I'm going to talk about three of our solutions: Reveal for diabetes, Reveal for lower GI, and Reveal for lung cancer. And I think you'll see how clinical data integration is essential for getting good results from predictive analytics. We'll start with diabetes. Almost a quarter of patients with diabetes in the United States are not actually diagnosed. And yet a patient with diabetes costs $4,600 more per year to care for. And that's before they begin to progress to CKD and heart disease and other comorbidities. So we asked the question, what if you could target and find patients who don't have a current diabetes diagnosis, who don't even have current lab results, but use the clinical data you do have to find and diagnose patients who have uncharted diabetes and do so with about 5 times the typical efficiency? So that's the idea behind the use case here. We take EHR data, and certainly the more complete the data, the better. So we use EHR data and an innovative AI model that takes existing patient data, risk stratifies patients so that providers can target outreach to those patients who are most likely to present with diabetes, even if it's not charted yet. So if you start with a group of 100,000 patients, you can risk stratify to the top 3%. We make the assumption that about half of those patients, when contacted, will come in for a blood draw. You can run updated labs, and that will generate over 200 additional patients that you've found with previously undiagnosed diabetes. That allows proactive management of their symptoms and their care. It prevents avoidable ED and inpatient admissions, and it obviously prevents more costly deterioration. And as I understand it, new risk adjustment scoring that was implemented this year actually encourages early diabetes diagnosis.